the first principle we're going to be looking through is the capability versus demand principle. What this principle means is an interplay between what an athlete can physically do versus the requirements that a sport places on them. And this is really important for a number of reasons, but primarily it's around injury prevention and understanding the needs of the athlete for the sport. So within the context of hockey, this is going to give you a good overview of aligning, firstly, the principles around needs of the sport that we've looked at already in the first overview section, and secondly, how we can begin to assess, which is what we're going to look at in the next section. So to begin with, as a overall philosophy, this is a philosophy that I've developed and has been sort of developed through mentorships with my time in the IS and various other people who I've worked with who've kind of helped to shape this for me. But this is generally how I approach training. On the left-hand side of this kind of bridge, we've got capability of an athlete. And on the right-hand side, we've got the demand of a sport. So the capability is determined by assessment, which we're going to look at in the next section. And on the right-hand side, the demand is based on a needs analysis. So the second section gave us a good understanding of what the sport requires of us, what the main injuries are, and what the running demands are of the sport of hockey. And then on the left-hand side here, setting us up for the next section, what actually an athlete is currently physically capable of. And in order to get over this bridge from where an athlete is to where they need to be for their sport, training is the thing that gets them there. It's a physical bridge by which we enable an athlete to tolerate demands and hopefully be able to exceed them, so that, having already looked at that overview of the needs of the sport, we can be in a better position to excel on the pitch. So that's the kind of overall philosophy. Training is trying to bridge the gap between these two factors. A quote taken from a recent article, which Roy Barber wrote for us, is that risk is heightened and injuries occur when the sporting demands imposed significantly outweigh an athlete's capabilities to tolerate them. What this means is that injury ultimately is an interplay of capability and demand. So if a greater demand is placed on a tissue than it can tolerate, then risk is heightened, and worst case scenario, injury may occur because that tissue isn't able to withstand the amount of loading that is being asked of it. So our job as practitioners and as strength and conditioning coaches is to increase the capability of an athlete physically so they can tolerate more demands placed on the tissues, which ultimately helps to reduce the injury risk. And some injuries are freak accidents, they're acute, getting hit by a ball, or a kind of a freak accident that we couldn't have predicted. These things we can't necessarily do things about. Injuries will always occur in sport, unfortunately, just because we take risks when we play sport, and therefore sometimes injuries occur. But the things we can do, we can kind of help with here are soft tissue injuries. Things that are related to acute load that's placed on tissues is exactly what the role of the S&C coach is there to help to increase capability relative to sporting demands. And so that was hopefully a useful sort of summary visually on that first slide, and secondly with this quote here to demonstrate that if we can increase capability, we will help to reduce the risk an athlete of them getting injured. So this is what I've called the delicate dance of demand. We have on the left-hand side capability and on the right-hand side demand. So as you can see in this example, the capability pushing down physically as more capability means that the demand isn't kicking us down on this other side. And on the flip side, if the demand outstrips capability, then we're going to be leaning far too much towards this demand. The athlete can't keep up, and this is an out of balance seesaw, if you like, and the demand is going to be too great for the athlete, and they are definitely going to be at risk. So if we just stop and take a quick example of this, this could be, and I use this a lot because it's such a common injury, but at the ankle, let's say that the forces experienced during running can exceed 3 to 4 times body weight of force through the ankle, but through assessment we realise that an athlete can only tolerate less than or up to 2 times body weight of force. When we come to doing high-speed running in hockey, the risk at the ankle is heightened because the capability of the athlete is poorer than the demand being placed on it. So our job may be to increase plantar flexion force at the ankle joint through things like high-load isometrics or heavy-loaded calf raises. in order to increase the capability at the ankle joint. Or maybe this is related to range of motion. This is another factor we're going to be discussing in a second, but it could be that the range that an athlete can produce at a certain joint isn't sufficient to tolerate the positions that hockey puts you in, which are relatively extreme, particularly in low positions. So there's two clear examples there of how the capability is going to be lower than the demand being placed on the specific tissues. So types of demand, we've got three kind of broad categories: force, volume, and range. Force is primarily the thing that causes injury in an acute sense. So if you imagine, for example, in this image of Giselle Ansley here performing a drag flick, the amount of force that's going through the lumbosacral joint, for example, or through the hip joint is going to be relatively high. If we're not prepared for those sorts of demands, then the demand is going to be higher than the capability an athlete has got. So we need to be able to assess what they can do, understand the demands, and get them closer towards those requirements that the sport places on us. Volume is more of a chronic injury sense. So this could be something like tendon overuse injuries, where running volumes are significantly higher than an athlete's capability to tolerate these. Classically, this would happen, for example, during pre-season, where having had a few weeks off, athletes suddenly kick up to big volumes of running in the week. And again, the tissues aren't prepared for the sudden increases in volume. And without ensuring that we understand what the demands look like, and we've obviously looked at that in section 2, we now know what the running demands look like. If we were to not prepare adequately for that, then the amount of running experience during the sport may cause issues in regards to volume-related injury. And finally, range. We know from simply observing the sport and from research that the positions we're trying to get into in hockey are pretty extreme in terms of the range of motion at the hip, the sort of positions thoracically need to be in, and these low repeated positions. So if we haven't got the adequate range at the ankle joint, the hip joint, the lumbosacral joint, the thoracic spine, there'll be more stress placed on tissues, because stress is force divided by cross-sectional area. So if we can increase the range at which force is experienced, we dissipate the amount of stress that tissues will experience. Conversely, if the amount of range is tiny, then there's lots of force over a small cross-sectional area, or the forces will be experienced in other joints, which is obviously going to create other compensatory problems later down the line. So implications-wise, so there are three very clear things we can do. We can increase strength, so this is increasing the amount of force that an athlete can express at a joint, both locally and globally. Increase capacity, so this is, for example, if we go back to the ankle analogy, increase the number of calf raises an athlete can achieve, because by increasing the capacity, we increase the work capacity of the joint, and that means that we can tolerate more work. And then finally, increasing range. So through mobility work, soft tissue work, we can increase the range of motion at certain joints, which is going to enable athletes to tolerate these key positions much more effectively without increasing the amount of stress and loading on certain tissues. So if we, again, just going back to the ankle analogy, we'll use this to kind of frame this capability demand sort of equation. So ankle sprains, in order to prevent these things, it comes down to increasing the capability of an athlete physically. So plantar flexion force, in other words, pointing your toes away from you. We can assess this using, if we have the capability on a force plate, but we can obviously do this using external loading as well, so that the weight on the bar. But the gold standard is obviously using a force plate. But for most people in the hockey world, simply using kind of something like a barbell to measure this will be appropriate. So you can load this pretty heavy, but obviously just do it safely. That's the key. Make sure it's being done safely, and actually a much safer way of doing it is than a leg press, but that's something which we'll be able to discuss at a later date. But in principle, trying to increase the plantar flexion forces up to the sorts of forces we're going to be experiencing during running is going to help to mitigate the risk of injury at the ankle joint. Increasing calf capacity up towards beyond 25 reps is a kind of ballpark would be good, and closer to 30 even better. And then increasing dorsiflexion range. We've got more range of motion to play with, which is an important factor, and some research sort of indicates that the reduction in risk a reduction in range at the ankle joint increases risk of ankle sprain. And this sort of makes sense, because if your foot hits the ground and it doesn't have anywhere to go at the ankle joint, then it will invert because there is range that can be gained there. So that is another way we could potentially try to mitigate ankle risk. And then finally, proprioception, which is something we haven't mentioned, but simply being able to understand where the joint position is in space is another important factor. And often with things like ankle sprains, consequently later down the line, athletes have poorer proprioception at the joint. And this is the same for shoulder injuries and various other ones. So we can also increase single leg balance. So there are 4 different ways we can approach this. And all of these things come down to increasing the capability relative to the demand placed on the ankle joint during the sport. Okay, so to finish up this section and to kind of wrap it up, in summary, this is what we call the demand capability equation. So on one hand, we've got what an athlete can do, and on the other hand, we've got what an athlete needs to be able to do. And I've used this ankle analogy to kind of highlight exactly how the demand placed on the joint can be mitigated by increasing the capability of an athlete physically. But this can be done across multiple different joints and multiple different examples. For example, in the running sense, if we can increase an athlete's tolerance to high-speed running, we can reduce the risk of things like hamstring and adductor injuries at high-speed running. And once we know from the previous section what that looks like, we can then begin to gradually increase their tolerance over time in a logical, progressive manner that overloads them appropriately. So I hope that's been useful, and in the next sort of set of principles, we're going to be looking through the overload principle and also through individual needs and a couple of others that are related to the underpinning principles that shape training programs.